Cataract surgery is the most frequently performed ophthalmic procedure, which is performed over 1 million patients a year in the United States only. Ultrasound phacoemulsification is the gold standard for cataract surgery, and until recently, laser technology is not widely used in this procedure. However, that is about to change. Their evaluation has begun. At present, there are several devices that use the femtosecond laser technology in cataract surgery. With the help of these devices, we can replace all manual steps to be done by laser. Femtosecond laser can produce customizable, clear corneal incision with any preferred architecture. Capsule rixes can be done with any preferred shape and size specified by surgeon to ideally suit individual intraocular anatomy and selected intraocular lens. The femtosecond laser also offers laser cataract fragmentation by performing linear cuts. Laser separate cataract into tiny pieces that then more easily can be removed by ultrasound phacoemulsification. However, femtosecond laser fragmentation can be used in soft cataract, and we still need to use ultrasound to do cataract removal in hard cataract. In the last 20 years, some surgeons tried to use laser for fragmentation of cataract, but these technologies had common disadvantages. They can only remove soft cataract, and for that they didn't find wide use in practice. In 1995, at Fyodorov Eye Microsurgery Complex in Moscow, a new laser system was introduced by Professor Kopayeva and Dr. Andreev. This laser machine based on use of ND-YAG laser with 1.44 mm wavelength with the original construction of bimanual handpieces. The advantages of this technology that this laser can safely and efficiently remove hard cataract. The technique is bimanual. A separated laser handpiece and irrigation aspiration handpiece are used. The laser tip is 0.7 mm in diameter are inserted into the eye through paracentesis of 0.8 and held with the dominant eye. The irrigation aspiration tip is 1.7 mm in diameter and has a spatial silicone shield. This shield provides the additional protection of the endothelium by 3 ways. It preserves the viscoelastic material from quick aspiration. It protects the corneal from reflected acoustic wave. And it prevents the small lens fragments from touch with the endothelium. Our suggested vacuum system based on use of separate tip for irrigation aspiration and uncombined with function of laser energy supply allows solving a problem of repulsion of lens fragments from aspiration tip. Laser energy does not repulse, but it directs the stream of lens mass away. The technique of a fragmentation consists of 3 stages. First stage, crater formation. Second stage, laser chop technique. Third stage, fragments removal. First stage, crater formation. Destruction of central compact piece of the lens nucleus is started by a slight touch of the laser tip to a lens surface in the cornea's center. Central and deep defect in the nucleus was formed. Next, moving radiation towards the crater walls. Its expansion peripheral lens rim decreased from 1.5 to 2 mm. Second stage, laser chop technique. Using the energy of acoustic wave of laser impulses forming the chopping lines is made without any mechanical pressure in dividing the lens nucleus into 4 fragments. During 5 to 15 seconds, a laser tip was fixed over a conjectural chopping point, and the surgeon is observing the appearance of the chopping line. Generation of radiation was stopped only at the moment of forming of the chopping line, going from periphery towards the center or after connection to already formed earlier chopping lines. Third stage, fragments removal. The irrigation aspiration handpiece is rotated 180 degrees and the silicone shield is inserted under the lens fragments. Lens fragments were suctioned in turn towards the aspirating orifice by vacuum and were destroyed by laser radiation in front of the entrance to an aspirating canal with simultaneous aspiration of crushed lens material. Putting off the shield under the lens fragments was not technically difficult. When the shield's wedge-shaped segment was lifted slightly by a laser tip, it was moving smoothly in the capsule and it spontaneously went under the lens fragment. This shield is so thin and elastic that can't damage the posterior lens capsule. This shield allows surgeons to do intracapsular fragmentation, and which will reduce the risk of posterior capsule rupture. Finally, we can summarize the advantages of this technology in the following. This elaborated surgical technology of laser destruction and cataract removal, which is fulfilled by a slight touch of laser tip to the lens surface, without mechanical fragmentation of nucleus or pressure on the lens, with a special protection of the posterior lens capsule by silicone shield on the working piece of irrigating aspirating tip, allows to destruct the cataract of any density's degree. Absence of hitting of laser tip and surrounding tissues in the working zone allows to seal the anterior eye chamber with working tapes, to stabilize intraocular pressure during the surgery and to exclude any tractions of zonular fibers caused by turbulence of anterior chamber. There is no pressure of working tools on nucleus and capsular bag. It increases indications for the surgery on eyes with weakening of zonals. There weren't side effects of laser energy influence proved by performed clinical investigations. Fluorescent iris angiography, endothelium microscopy, optical current tomography. After laser cataract extraction, loss of endothelium cells does not exceed from 2 to 6%. In conclusion, we believe that this technology of laser cataract extraction in combination with femtosecond laser technology will open the door for all by laser cataract surgery. And when our patients ask, "Doctor, can you remove my cataract by laser?" we can answer him, yes, we can.